clearly there are changes that occur in both male and female bodies as a consequence of aging, but you can dramatically speed up those changes by prematurely aging by adopting health-compromising habits and lifestyles, not getting enough sleep or exercise, eating a high-fat, high-protein diet based on animal foods. I think that many of our patients find that when they adopt a health-promoting diet and lifestyle, that is, they eat a plant-based, SOS-free diet, they get regular exercise, they have appropriate amounts of sleep, and their stress exposures are under reasonable control, that many of the problems associated with the menstrual cycle are minimized. For example, it's thought that excess accumulation of estradiol is associated with conditions such as fibrocystic breast disease and dysmenorrhea and cramping and bloating and many of these problems. Well, estradiol converts to estriol in part by action in the liver and also the intestinal flora. So by maintaining a normal intestinal flora, you may be able to maximize appropriate conversion of things like estradiol to estriol and excretion, which may normalize estrogen levels, which may minimize the fibrocystic breast disease and the dysmenorrhea and many of these conditions. The other thing that can be done for people that are having these problems, and they've done a good job at trying to make the diet and lifestyle changes, but still are suffering, is they can undergo a period of medically supervised water-only fasting. And this can be extremely effective at kind of rebooting the system. It's much like turning off a computer and turning it on. It clears a lot of material out. And as a consequence, then adopting a plant-based SOS-free diet and healthy lifestyle are sufficient to help normalize these dysfunctions in many people. Some variation amongst individuals, but you know, the prototypical 28-day cycle isn't going to be necessarily true for everybody. The severity of bleeding, intensity of cramping, etc. also varies, but the general rule is that most people that are healthy have limited difficulties going through this very natural cycle and process. Sometimes people can feel that menstruation or the menstrual cycle is an abnormal process. I disagree with that. In fact, if people are too thin as women, the body will actually stop ovulation.
Sugar is one of the main things that creates PMS. And the research shows that there's a 278% increase in PMS in women having a lot of sugar. Now we did a survey of 520 people, and two-thirds of them are women. And the woman doing the survey was very interested in, well, how does live food affect your period? How does it affect your menstrual cycle? We got very, very positive results. And summing up in a really simple way, that women who were, these were 80% or more live food, they had less long periods, less pain, and more sense of well-being on at least 80% live food diet. And what we would tend to see is, instead of long, heavy, painful periods, and that may truly happen in a period of detox. So we're talking people at least doing this for 2 years, because time is important. So after 2 years, we're talking about people that are fairly cleaned out in terms of what they're doing. Basically, the menses comes down to 1 or 2 days. It's very, very mild in its expression, and women go through it very well. And so we're very pleased with the results. So that's what we're going to say there.
There's a lot of options in terms of deciding whether you want to get pregnant or not get pregnant. And it begins with understanding the female cycle. There are entirely natural means of birth control, which when used in combination can be reliable in terms of temperature measurement, cervical mucus, etc. So these natural birth control methods are useful both for achieving pregnancy or avoiding pregnancy. By understanding when you are fertile, you can make decisions about your exposure and likelihood of pregnancy. There are also mechanical measures of birth control, which most people are familiar with, that have varying degrees of effectiveness and safety. Then there are methods of birth control which I think are health compromising. and present potential complications. Most of those methods are used strictly for women, because I think, frankly, men wouldn't put up with a lot of the risk factors associated with things like IUD and birth control pills. So, obviously each woman has to decide what level of risk and exposure they're going to have to take, and if they're trying to achieve pregnancy or they're trying to avoid pregnancy. Probably the most important thing is to get healthy enough to have a regular and predictable cycle, and then learning to understand what techniques are available to identify when you're fertile, when you're less likely to be fertile, and then regulating your sexual exposure so that you can minimize or maximize the likelihood of pregnancy. I'm not a big fan of IUDs just because of potential complications, and I think that there's, that healthy women that are able to control their environment are able to find reliable means of achieving or avoiding pregnancy without having to resort to mechanical intervention that can lead to, a variety of sometimes serious health compromising problems.
As a physician, looking what normal, I am normal, look at amenorrhea. Usually amenorrhea is something we see in women who don't have enough fat on their body. And we have women athletes, we see it very, very common. And I think it's more than the fat. I think something actually happens to the ovaries a little bit, because a lot of women come with that complaint. And basically we really try to activate the ovaries, putting a little bit more fat on the body, because the fat carries a lot of estrogen. If you aren't having a period, I don't consider that healthy, because that's not the way we're designed. So I like to see, the women that seem to do the best, seem to be the happiest, our women are actually having a light period for a day or two, and that's what we see eventually happens on a plant source only diet. That's what I'd say. If you aren't having a period, I would be concerned, because that's not normal. And usually my experience in checking women who come with that problem is that that their ovaries are weakened and they have just too little fat. So that's kind of the summary of that. I don't idealize women not have their period because of what I've just said.
They've lost their period because they're either underweight or undernourished.